If you've seen the movie Willy Wonka and the Chocolate Factory or Charlie and the Chocolate Factory, or you've read the books, there's a character called Violet Beauregard who ends up turning into a blueberry. And Willy Wonka knows that the candy that she eats ends up turning people into blueberries. They're testing to figure out why they're turning people into blueberries. The tests that the Willy Wonka's people are performing to figure out how and when people are turning into blueberries could be a version of titration. One of the Oompa Loompas is tasked with counting how many of these pieces of candy the people eat before they turn into blueberries. The point at which that last piece of candy turns you into a blueberry is known as the equivalence point. If you were to put this on a graph where you have the number of blueberries on the x-axis and you put the side effect, or in this case, how close they are to turning into a blueberry on the y-axis, you'll be able to draw a graph that looks like this, where that point, where it's halfway between how much side effects you're getting and how many blueberries you're eating, that's the equivalence point. After that, you're tipping into turning into a blueberry. So they're trying to figure out exactly what point it is before you turn into a blueberry. In medicine, titration is the same concept. If you're trying to give a patient a new medication, you don't want to make that patient overdose on the medication too soon. So you have to slowly up titrate or increase the dose of whatever medication you're giving to your patient until they reach some type of efficacy and there are minimal side effects. There's always this balance when you're titrating drugs with patients between how many side effects they're experiencing and how effective the drug is. Clearly, the higher the concentration of the drug, the more effective the drug is going to be. But the higher concentration also might mean that drug is now binding to things it wasn't supposed to bind to, and you experience way too many side effects. That balance between the two is also known as the equivalence point. When we're talking about the titration of drugs, the thing that is being titrated or thing that's being added is the drug itself. The solution into which it's being added is the blood. Figuring out how many molecules or moles of that drug you need to add into the solution that's known as the blood is another version of titration. When you're calculating values for titration, you have to remember molarity is the moles of solute over liters of solution. In the case of medications in the blood, the solution is the blood. One specific side effect that doctors need to track when they're testing new medications in patients is the pH of the blood. Blood is not just responsible for delivering the drugs, it also delivers oxygen to all of your cells and so many of the other nutrients that your body needs. So if the pH of your blood changes even the slightest amount, it also is going to impact the function of any enzymes that are in your body. So to track the impact that the drug concentrations are having on the pH of the blood specifically, you can also make a graph where the side effect is simply just the pH. There's going to be an equivalence point on this graph. However, when you're testing out to figure out what that exact point is, you want to make sure you're going really slow to get as exact as possible. So you might want to use something known as an indicator. Another molecule present within the solution will change color at a very specific pH. Titrations are predominantly done when you have a weak acid and a strong base, or a strong acid and a weak base. If you have a strong base with a weak acid, your overall pH is going to be above 7, so you're going to want to choose some type of indicator that has a pKa over 7. Two common indicators used in chemistry experiments are phenolphthalein, which is used when a strong base is reacting with a weak acid or you're expecting the pH over 7, and methyl orange, which is used when a strong acid is reacting with a weak base and the resulting pH is going to be less than 7. Because you have the indicator, you know exactly the pH at which something changed, but you don't know exactly what concentration you were at where that change occurred. You can also use the equation pH equals the pKa plus the log of the acid over the acid bound to the hydrogen to figure out how much of a concentration has changed. The important thing to recognize when doing these calculations is that because this is all based on the logarithm scale, these are all going to be exponential increases or decreases in the hydrogen's concentration. It's also important to remember that all concentrations are a measurement of the molarity, or the moles of solute over the liters of solution. In order to calculate exactly how many moles of something that you have or that you are gaining, when a strong acid reacts with a strong base, it fully dissociates, creating salt and water. When a weak acid reacts with a weak base, there's barely anything that is going to dissociate at all, and you're not going to end up seeing very much of a pH change. So weak acids with weak bases and strong acids with strong bases are rarely used when doing calculations around titration. You have to be able to do something called stoichiometry. If you need to review stoichiometry, check the video linked in the description below.